All right. Hi, everyone. I hope you all are doing good and having a wonderful day. So, welcome to today's session. And before we start today's session, I would like to introduce our platform, Positivity. So, Positivity is a Singapore based and headquartered mental health organization, and we are committed to making quality mental health care accessible and affordable for everyone. And our aim is to connect individuals with the right experts on our platform while creating awareness around important topics. And speaking of topics, today we have a really good topic, which is breaking the stigma and caring for addiction survivors. Now, addiction is often misunderstood and it's highly stigmatized as well, so it makes it even more difficult for individuals to seek help and sustain recovery. So, in this session, we will be discussing a lot about addiction and how what stigma looks like and why recovery isn't always linear. So, today's session will be presented by Miss Annapurna Thakuria. She is a counseling psychologist and a psychotherapist, and she works with adults who feel overwhelmed, anxious, stuck, or uncertain about their future or direction in life. So we are really happy to have Miss Annapurna Thakuria here today. And without any further ado, over to you, Miss Annapurna Thakuria.
Thank you so much. Uh, I just have to say a few lines before I start. Uh, Currently, I'm having a network issue, so I may not be very much audible, but I'll try my best. And do let me know if I'm audible right now.
Yes, you're audible.
Okay, great. So, thank you so much, Shreya, for my introduction. And along with people who are having other mental issues like anxiety or stress or overthinking, I am actually also working with uh, addict patients for the last 4 years now. And um, I think I, when I found this topic, I thought I would be really helpful to talk more about it because overall, when we talk about addiction, we do talk about the addiction circle. We do talk about how addiction starts, what is addiction, what happens to the patients, but we rarely talk about the stigma and also how we as a community or we as friends, parents, guardians can help those people who are suffering from addiction. So I myself have presented, I think, two or three presentations before on addiction or some kind of addiction, I guess, alcohol and something else at Positivity itself. And today I'm very glad that I'm actually able to uh, give a webinar presentation on the other side of addiction, which is the stigma and how to actually care for those people who are trying to recover from this cycle of addiction. So without further ado, I would like to slide share. Um, Give me a minute. Might take a while for the slides to show up. Really apologize for the inconvenience, but it is as it is. So, all right. Uh, Welcome to everyone again to another new topic. This time we are talking about the most important aspect of addiction, which is caring for addiction survivors. And we are talking about how we can uh, help the addiction survivors without having a stigma against them. Now, first thing first, let's talk about, uh, we've already talked about positivity. Uh, let's talk about addiction. So what in general we know about addiction? Addiction is basically a health condition. All right. Addiction is a mental health condition, and the people are not ready to talk about this. Of course, you and me who are involved in psychology, understand this fact very well, but the majority of the people uh, who have definitely heard this word addiction, they have definitely heard this word. They know what causes addiction. They know that it, you know, alcohol, hard drugs, um, other substances, as well as sometimes games or other such things. But what people fail to recognize is addiction is actually a mental health condition. It's no more a choice. Addiction is never a choice. It is something that affects your brain, it affects your emotions, it affects your behavior, it affects the relationship as well as your physical health. In simple words, addiction actually affects three parts of your life: it's the physical health, it's the mental health, as well as your social health. Now, when we talk about social health, a major part of the social health consists, or I mean, society consists of the immediate family, friends, and the other maybe institution, the person attending school, colleges, workplace, or the neighborhood. So that is the reason why so social stigma or social or the society can help the addiction survivors. Okay. So most people believe that addiction is just a lack of willpower. It is just um, something that people have chosen. All right. So I'll give you a simple example. Somebody who has, let's say, diabetes, we would not tell them that you are having diabetes because you had previously had a lot of sugar. You have had a lot of sweets. You did not care about anything else, and that is the reason why you're suffering from diabetes. And we will not ignore that person. We would not stigmatize this person. We would actually be more sympathetic towards them. We would be like, oh, you have diabetes, or commonly known as, oh, sugar ki bimari. So that's how we would sympathize or empathize with this person. So addiction is also something that is the after cause of using substances, any substances for that matter. But today, let's talk about hard substances like uh, alcohol, drugs, cigarettes, or other such drugs, which I do not want to name at the moment, but let's consider them as hard drugs. Anyway, so when a person chose to have that substance or that drug or alcohol, that was his choice, his or her choice. But the addiction is the result, or the disease, it's a condition that comes after the person has been suffering from everything. Addiction is when he's not able to control his own emotion, he's not able to control their own behavior. Okay. So I would not go broadly on addiction. I've just talked to you simply simple terms. The main things that we can remember here is addiction is a health condition, it's a mental health condition. Secondly, uh, the person suffering from addiction actually has it, it affects their brain, their emotions. So they no longer can control their uh, emotions, their brain. So what happens? Their cognitive skills or their decision making skills, that those weaken down. And that's the reason why even if they think that no more alcohol for me, no more drugs for me from tomorrow. But when tomorrow finally comes, they would be forced to uh, get out or get another shot. Okay. Now let's talk about how addiction changes the brain. So before I explain this, I would like to say about one um, recent talk that I had with my client, I think just a few weeks earlier. This person who was then he was recovering in the place I work at, and that person told me that how the mind of an addict works. Okay, or how the mind of a person who's trying to cut down his addiction but is not getting proper help works. So the morning, for example, in the morning they would decide that uh, today will be a good day. I will not use this substance. But by the afternoon, there is withdrawal symptoms. So, for those of you who do not know, if you are continuously taking a substance and you do not get the substance at the same time or after some time, you start showing symptoms. In medical terms, we call it withdrawal symptoms. Symptoms, when I say symptoms, it's actually very severe symptoms to moderately low symptoms, but um, you can say that there would be severe headaches, there would be joint pains, there will be the person suddenly might feel very cold, might feel very hot, irrespective of what weather conditions are there at the physical moment. And then there will be irritability, uh, weak decision making skills again. They do not understand what other people are trying to say them, and that is the reason why at that peak withdrawal symptoms time, no matter how you explain them, no matter how much love or even anger you try to explain them not to take the substance, they will not understand you. The cognition part is completely blocked at the moment when withdrawal takes place. So the person who decides in the morning that he will not take substance, by the afternoon the withdrawal peaks, and the only thing that is continuously hitting their mind is how do I get the money to buy another shot, let's say. Then they would only think about how to get the money. If the person is rich enough, if they have enough money on their account or at the moment, then they can go and buy the substance, whatever it may be. But if they are not that uh, capable to buy, because let's be honest, these substances are not very cheap. So they have to try other means. Now, I already said before, ki it affects the brain, so the decision making skills are very poor. So they go for other secondary things which may not be really helpful or ethically, morally, legally wrong, like robbing, like uh, stealing from household, from others as well. So in small towns these days, or maybe I don't know, it might be the case at big cities also. There's examples of uh, pickpocketing. There's example of snatching from the neck, or big robberies, all because of things like this. So at the moment, you cannot blame the person because at that time they are not thinking well. They are just planning how do I get the money to buy the substance. So once they acquire the money, they do not think for the future. So like how we plan something and we earn money, we save money. So substance users or addiction, until that moment they do not realize that they are addicted. Okay, so that's another part we'll talk about it. So, so they try to earn the money or get the money by anyhow, and then they consume. They go buy and then they consume the substance. They feel better and then they feel guilty about it that they took the substance yet again. Then they think from tomorrow I'll not do. So the cycle repeats. So the physical health, like I said before, physical health is affecting. If you're heavily consuming alcohol, let's say, then you know what's happening. Your liver is getting damaged, your brain cells are getting damaged. Let's say you're taking cigarettes, your lungs are getting damaged. Okay. And then if you're taking other hardcore drugs, the other parts of your brain are getting damaged, other hormonal systems are being damaged. Mentally, the parts of your decision making skills are getting weaker. Your what do you call it? The part of your brain which is very important for giving showing focus or being very attention, that is being damaged. And then slowly uh, you're forgetting things. It's becoming all blurry for you. And then there's societal changes. How is it affecting your relationship with your parents? I will give you an example, which is uh, so I had a mother come to me, and she was very much sad when she told me that her son was going through all this situation. And then, uh, so what happened was like she was suffering because the situation of the home was like that. Her husband used to take alcohol, her son used to take other substances, and the entire house for her was being very much negative. So it's affecting the society. Okay, the society, your immediate family is getting affected, your parents are getting affected, and if you're married, your husband or your wife or your children are getting affected. Then at your workplace, your colleague are having problems. Because if imagine if a person comes heavily intoxicated at workplace and they're not able to focus, the HR or the the immediate uh, superior would not see who's not working. If anybody from the team is not working, then the entire team gets banished. So the entire, the immediate society that you come from or you go to, you belong to, is having problems because of one person's addiction. So addiction, when happens, the brain's reward system is altered. That means uh, the brain does not. So okay, for those who do not understand, we have some chemicals or neurotransmitters, chemicals for you, chemicals in our brain that releases when we are happy. Let's say for genuine happy, if there is something, let's say, if we are genuinely happy that we got a valuable gift from somebody, let's say, or something, we got a good job, the genuinely happy hormones got released and we are happy. What happens, for example, we took a substance and the happy hormone is released without being genuinely happy. It acts as a fake alarm. So our brain now thinks, to be happy we have to consume this substance. Okay? And that is the reason why there is this narrative that you and me hear all the time, that I am drinking because I was having stress. I am having a little bit of drinking because I'm going through stress. Now, is it really true that uh, only when you are stressed, or if you are really stressed, if you drink, your stress will go down? That's not something that is actually happening, but we are making, or the substance is making our brain think into that way, that once you are drinking, the stress will go away. It's just another system that our brain has made us think to it. So this happens while we are consuming the substance. So despite knowing the harmful consequences, we start using the substance. There is no self control, it becomes weaker. And like I already said, the decision making skills get affected. Now, talking about the most important part of the topic, about stigma. So, we all have heard about some myths, and today I'll be fact checking on those myths. The first thing is, most of us in the society believe that one person who is consuming substances, they can quit anytime. But the fact is, for recovering from that addiction, it often requires treatment and support. There are cases where people are able to uh, get better or quit after a few months or years without proper treatment, but that's only in cases where it was not very severe dependency or addiction with that substance. And I've already said addiction is not a choice. Yes, initial choice of the substance may be voluntary, but then the addiction changes the brain and it no longer becomes your choice. It has to be there because otherwise the person is suffering from other symptoms in the body. And even though I have been saying symptoms, if you are not understanding, or if you have not seen a person going through that much of pain or that much of physical uh, and mental suffering, so you will not understand the gravity or the intensity of the person that they go through in withdrawal symptoms. I can only tell you that it's worse. The, the whole body, there could be hives, there could be itching. Uh, then there is, other problems like, as I said, joint pains, severe joint pains, sudden shivering, even degrees, person is shivering, and then there is sudden uh, sweat, even sitting down at maybe 22 degrees Celsius AC temperature. Also, this person is sweating like anything. these things are very serious. And then the brain has, it has it has circuited around that in the similar way that only when the substance will go inside, it'll start to feel better. And another myth is that, the people who are consuming substances, they do not care about their family. And that is the reason they go out and, consume, let the family suffer. But like I said, it's not the truth. The fact is, they do feel guilty, they do feel shame, but they struggle to stop. They tremble like anything, they shiver like anything. Sometimes they even have symptoms like fits or what do you call it? You know, convulsions. They just become senseless. But these are all withdrawal symptoms. Senseless and convulsions are mostly seen in alcoholic uh, users, or but somebody who has been using alcohol since the last 20 years of life, and now at the age of 50 or 55, if they are trying to get better, then the withdrawal symptoms are even more intense. And then there is fourth one, which the guardians or the family of the uh, survivors or the recovery patients tell me, is that relapse is meaning failure, that they are good for nothing. But relapse is actually part of the journey. It can happen. It's actually a part of the recovery journey. Okay. Now, when we talk about stigma, stigma basically happens for two types. And I'm assuming that you know what is stigma. Stigma is basically when there is a negative outlook of a person, of something in the society. So here we are talking about stigma, which goes around addiction survivors, or those people who are trying to get better from addiction, but then there is still stigma. And they are on their recovery journey, but then there are a lot of stigmas. So there are two types of stigma. One stigma that is coming externally from the, you know, from your workplace, from the family, from the communities, even from providers, and even you're working at the hospital, you're being treated at. Because there are some people who are not very knowledgeable how to treat with those people who are trying to recover themselves. And then there are internal stigma. Internal stigma is when they talk or they feel bad about themselves, like this, the guilt, the shame, or the feeling that they know that they are doing something wrong, and that's even worse, but they're not able to help themselves. Now, what does stigma look like? Okay, now it is stigma. So we'll come, how does stigma look like, but how does stigma hurt? Stigma can lead to shame if continuously poking, or especially I've heard, as a family, let's say, a person who is into their recovery journey, in one, let's say in a de-addiction center or a hospital, how long can a person be there as a, let's say, as a inpatient uh, there? Hardly 3 months, 4 months. Then they'll have to come out of the rehabilitation center or the addiction center or the hospital and come back to the family. If the family keeps on nagging, keeps on, you know, telling them words of shame, words that, you know, you are for you, we are not able to show the face in the society, and these kind of words that you and me maybe have heard once or twice in our life for someone else, or maybe unknowingly were a part of the conversation when we ourselves have might have been told someone that he's a drunkard, or she is an addict. Let's ignore them. Maybe we were there. So these can lead to shame. This can lead to isolation. They do not They feel like being alone is better, can lead to anxiety, can lead to depression, can lead to them seeking out for treatment, delaying their treatment, asking for help because they have put themselves in a trap like I'm already a bad person for my family, for my friends, for my society. Do I really have the courage to go out and ask, apparently from strangers, to help me if none of my own family members were able to understand myself? And if there is stigma, even after the person comes back from the addiction centers, or if there is, you know, continuously mocking or insulting even after he or she is returned from the addiction center or the addiction center, then there is an increased risk of relapse. And then there is loss of hope. Let's put a glimpse in this diagram. So, stigma firstly starts with these five things that we see in the inner circle. Mostly it's the labeling. Labeling is one of the most common stigma that you and I have seen, uh, maybe since childhood. Someone lying on the streets, we would immediately call them drunkard or don't go there. We would try to protect our children. He's just an addict. We would directly label them. Or imagine just labeling them as someone hopeless, someone garbage to the society, and words like that. These kind of labels that can actually harm them, hurt them. And since we did not know that before, that addiction is actually a mental illness, so labeling uh, was something that society, which is not very pleasant, but yes, there is a lot of labeling and you cannot really ignore that. And then there is division of us versus them, which is which means that the people who are apparently using some substances are someone that we should be stay away from, stay safe from. These kind of things are actually known to them also. They can hear it, they can see it, they can see themselves being avoided. And then stereotyping, there is negative attitude, thinking that, oh, this person doesn't really care about their family, their job, and discrimination. These are inner cycle. And what happens due to this? The cycle of loss happens. Loss of relationship, not just romantic relationship, platonic relationship, friendships. Siblings lost connection because they believe that there is no um, need or necessity to keep up with somebody who is apparently do not fit in their uh, you know piece of good people or in their own world. And then that leads to loneliness, that leads to shame, that leads to feeling discouraged, and there is fear to receive help. Simultaneously, if this thing goes on and on, one or other day you will lose your home, you lose your family, you lose your job, and again isolation. And this circle continues. Here is a hidden truth, and this is very important. When I was a trainee psychologist, and this was the first thing that I was trained while before working in the field of addiction, of course, that I could not actually find a better picture. So, um, but imagine this: we assume that recovery is straight line. A person suffering from addiction, point A, and point B is his or she is clean, sober after recovery. But the way to recovery is not a straight line. It's actually not even these clean lines that I have drawn in the right side, just up and down, up and it's actually more jumbled. It's like those wires when those earphones that gets connected at home. It's like that. It's very messed up. It's you know you see progress in the first week. Let's say you see progress in the first week, and then by themselves, when they are at home, then they they get a call from their friend. I'm just giving you an example. They get a call from a friend, and they'll be like, "Hey, why aren't you coming out these days? Come out, let's hang out." And this person is very much thinking in his head or in her head that I will be very focused. I'm been able to uh, control myself for the last 1 week, and I will do so further. They meet, they chat. There would be some outer pressure also. Definitely, there are peer pressure, but then the person has was very much stubborn that they would not consume the substance again. But there is this habit, something called as habit. You know what is happening when you see your friends doing the same that you once did. It's something that your body was used to it. Automatically you would think, "Okay, I'll just have one piece." It's similar to those, when our parents suffering from diabetes, when they would say, "Ki, just give us a small piece of the sweet. I'll not take the whole sweet, I'll just take a little bit of sweet." It's similar to that incident where this friend, when this person is meeting their friend, and they'll be like, "Just give, I'll take a small amount. I'll just take a small amount this time." But a person, here's the thing, a person who is on a no substance after a period, and then when this person takes again, then uh, they are not, a little bit amount is it's not enough for them, so the tolerance, what happens, it increases, so they will need even more amount this time. So again, relapse, but then they learn that, okay, I should avoid maybe this group of friends. And then one day suddenly they passes through a bad situation, maybe an argument for maybe no other reason, or let's, we are talking about stigma, so maybe there was some kind of stigma, so they argue with their wife or husband or family members, and then they just think, you know what can make me feel better now, maybe I should just go and take a shot, relapse again. So it's very jumbly, very twisted, it's never straight, it's always very much confusing. So it's never a straight line. So as layman person, as somebody who are a part of society, and today those of you have joined, I'm sure you are joining to know more about the the fact, or how to break the stigma, how to support these people who are going through recovery, or even if they have not properly gone through treatment, is in like in institutional treatment, but you think you will be able to take care of these people, then this is so much important, that recovery is not a straight line. There will be progress, there will be relapse, there will be again progress, relapse, progress, relapse, progress, relapse, 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 progress. So it just goes on. And then finally, there will be a stop point where there will be recovery. Now, huh. So we were talking about how relapse look like, and why is this important to understand or to break the stigma. This is actually very, very important for us to know how relapse actually looks like. First of all, why do people fall into the trap of relapse? Emotional, definitely there will be mood swings, there will be withdrawal symptoms, there will be poor self care. Then there will be mental relapse. How does it happen? Because they would be start thinking about, oh, the time when I used to do this, or maybe if I take less this time, I will not have that much of effect. Maybe if somebody loses control every time they are fully drunk, they would think that, what if I drink less this time? Maybe I will not be able to lose control. Maybe this time I'll minimize the consequence, right? And physical is every time they feel like, I need to go get the substance. So these are the very much symptoms that are seen in relapsing. And if you are somebody who is working as a secondary person, and if you can see somebody whom you care for and you are seeing the symptoms, then please do not waste your time. Talk to them politely. maybe they are still willing to, or there are other intervention which we'll definitely talk about in the later part of this slides. And it's very important to know that it's not just mental but also emotional and physical symptoms that leads to relapse. So addiction survivors needs four things. Safety, they need to feel safe. Safe does not mean being in a safe household. Safe means, of course, being in a safe household, but safe here means safe as in protected, protected, and not being judged, not being, uh, you know, outcasted, not being shamed, not being laughed at, not being insulted. So those kind of safety. They need a human connection. They need somebody to talk to. My clients tell me that, ma'am, this is the first time when they meet me for the first time, and then they tell me that, ma'am, this is the first time somebody is actually willing to listen to my side of the story because nobody at home did. They're always busy pinpointing me. So they need those kind of connection. Now, it does not mean that you have to be a psychologist to be having that connection. You can do it too. Stop stigmatizing. That is what we are talking about, right? How to not label them and try to listen. Maybe why are they trying to uh, go on and about in this cycle or in this circle of addiction? They need a purpose. If there is no purpose of their life, they end up having more or consuming more substance. It's similar to when in a day off we like to scroll a lot of phone or watch a lot of full day of just screen time because we did not have a lot of purpose that day. Here, the person who's going through or trying to recover from addiction, they need a purpose in their life. Purpose could be anything. Let's start with small purpose like to keep themselves happy, to keep their immediate family happy. Sometimes when I see married men, while asking for their dreams and hopes, they would tell that it's most they mostly would like to see their wife and their children happy again. They have suffered enough because of his action, and then they need hope. Hope that they'll one day get better, one day be able to restart what they were doing, maybe at work, maybe their passion, their interest, their hobbies once again. Not lectures, not lectures that you know this is the reason why you are the reason why our family is going down, etc., etc. They do not need lectures. They need these four things. And I think I have not added this in the slides, but this is very important. When you ask someone who you know is going through addiction, uh, firstly, being very non judgmental, you cannot judge them. And because you know right now that the reason why they are continuously going through addiction or continuing the cycle of taking the substances because of other problems like withdrawal symptoms and all. So it's a mental health condition right now. So instead of asking um, what happens when you consume this substance could be anything. What happens when you consume this substance? Have you seen what is happening? This is most common dialogue that most of us have used before. That what happens or what things are changed in your life after consuming this? When you ask this question, for us, you and me, it's a very normal question. So this person will probably think what has changed in his life. But that question can be hurtful for them because they have seen the adversity of what actually happened. So to get that answer, maybe we can like have another talk. But instead of asking that question, we can ask what could have been different when if you would not have taken this substance. Imagine someone taking alcohol and asking them, instead of asking what are the changes in your life that after happened after consuming alcohol, instead of asking this question, you can ask them instead, what could have happened if you would never have started alcohol? then see the amount of positive answers this person is forced to think, it automatically gives hope in them. And then they'll see the other side of the, maybe something that they have not thought about it. See, huh, I can also do, things would have been different. Maybe I would have a better job. Maybe I would have a better family. Maybe I would have more money. And then they would realize, then you know what pops up? The self awareness pops up. And self awareness is another important thing that addiction survivors need. Okay. Next is uh, about language shapes recovery. For some reason, the slide is okay. All right. So instead of using this, let's use that. Let's do quickly. Instead of calling someone as drug addict, let's call them as addict or alcohol. Like just call alcoholic or drug addict or drunkard. Let's just call them person with substance use disorder. It's very much popular in mental health background, but also as a layman person, we can use this. Right? They are suffering from substance use disorder. Instead of calling them abuser, let's call them person in recovery. A junkie, these are all slang words, but instead of using these words, we can call them, we can use them, definitely call them by their names only. We can use person experiencing addiction. Okay. Now, how to respond when someone relapses? Imagine you're working really hard for someone. As a caregiver like myself, you're working very hard for somebody who is trying to recover, or as a family member, or as a friend, and then they relapse again. First and foremost, I understand that there will be a lot of anger, but stay calm. Panic or anger would just push the person away from the most important support. Stay calm. Try to remember what relapse means, why people relapse, what is the circle of addiction. Relapse is a part of recovery. Avoid shaming and criticizing them. Remind them that relapse is a part of the journey, and a relapse episode does not erase their progress. Most of them believe that everything is done, everything is erased. Now it's better to go back into being a user again. Remind them gently that it does not erase anything. It does not erase the progress. It does not define their worth, or it does not erase any previous progress. So one relapse episode does not end their journey. In fact, it was just a hurdle. They'll be able to cross it. Dust themselves up, cross it. And as a supporter, what we can do best is being there for them at that moment. Instead of shaming them, criticizing them, judging them, being there for them at the moment when they feel lost and lonely. Yes, as a caregiver, as a uh, society, we are feeling angry to see the person relapsing. But imagine them, they feel worse, trust me, because they are trying their level best. They're trying their hardest also. Sometimes even consuming, if they're under treatment, then consuming those medicines, injections, and they do not like it, but they're still trying their best. And one relapse episode, after that, they themselves are feeling very much guilty. So being standing for themselves, standing for them is very much important. Remind them that journey, recovery is a journey, and these setbacks will be actually help them to heal. Then if there is anything wrong, if there is anything happening to them, you should be able to allow them to have a safe conversation with you without the fear or shame. Sit and ask what led them take this action. Is there anything that I can help for you, or I can do for you? Things like words like this, words of support, words of hope that can actually help someone going through relapse. Now, when telling about this, there is another important thing, which people, there's a very thin line, and uh, people definitely sometimes get mis helping and enabling. Helping is supporting the journey of recovery, listening to them, attending appointments, encouraging treatment, and most importantly, family counseling is also very much important. If you are a family or a friend, if a counselor or a psychiatrist or a psychologist or anybody from the mental health facility asks you to visit or have a appointment for yourself, please do not say no, because there is secondary uh, symptoms that caregivers at home also faces due to people or their family having addiction problems. So listen to them and go for your counseling family appointments when they call for it. Anyway, that's another thing here. When we have been talking about helping the addiction recoverers or survivors, we support them in their recover. We do not shame them. We listen them. We go for their appointments. We remind them for appointments. We encourage treatment. But we do not hide their wrongdoing from the other members of the family. All right. We do not hide their behavior from the maybe the psychologist or the counselor or the clinician that is looking at them. We do not give money without asking for accountability. We give them money, and uh, if we have to give them money, we would definitely ask them where they are spending, not being very strict, of course, but only trusting them, but definitely asking for accountability. And then make sure that even they do not put up any excuse, or you are not in a situation where you have to put or cover their truth or excuse to somebody else. Mostly it happens for over it's a type of care. I understand mothers try to care for their children and they hide the truth from their fathers, or the siblings try to hide the for their sisters or their brothers. Do not cover for your loved one. Do not take the blame for their behavior. Rather, talk to them. So, there is the distinction between helping and enabling. Helping does not mean you'll help them giving money, hide their truth, or do not talk about their relapse episode with the family or their uh, treatment givers. So, let's not enable them. Let's not uh, shame them as well, but let's not enable them. Let's ask whenever we are paying them money, or if they're going outside, let's keep a check, try to smell or try to see if they're again going into. Now, do not think it's a more a strict decision, but it's more like a situation where you're also being aware. Okay, this is a type of helping only, but do not enable them or cover for them, or you know hide their relapsing episode if there is ever one. What kind of emotional support that can actually help? Showing up consistently as a friend or a family. Just because your friend or one your family, like I previously said, maybe your sibling got into addiction, does not mean that it broke your relationship. Show up to them, talk about their interests, you know talk about their treatment, how to be better, talk about the outcome of recovery plans. Do not give advice to them that you should do this, you should do that. Be present for them. You can suggest them to go for treatments, but not using hard words like you should go, stuff, you must go. But rather, like, it's better if you would go, you would feel better. Do you want to go there? So, something like that in those words. If they're able to even, uh, recover in their recovery journey, they are able to have a sober day of sober week, a 1 week sober week. Celebrate as in not with the substance again. Okay, that was a joke. Do not celebrate with the I mean, you celebrate with them, be happy for them, treat them maybe with good things, and have a hard conversation with them. What if they want to say something? They have always had some fear, maybe they were afraid to talk with people. So if they start a conversation with you, congratulate them for that. If they went and gave a beautiful meeting at their job while being sober, congratulate on them on that. These are small support that we can show to our friends and families. Now, how can we do as a community? Okay, let's say you do not have a friend who is addict, you do not even have a family who is addict, but you might definitely have somebody in your community who is going through addiction uh, or substance use disorder. Community stigma is one huge barrier because people often say that the society is very shaming them or judging them. Society speak badly about them. They're not able to show their face again, stuff like that. So as a community, what we can do is, instead of shaming them, ask them gently, of course, that or if they are already out of the rehabilitation or the addiction system, then congratulate them for completing their treatment and let them know that if ever they need anything, any help regarding any tough conversation or just be there, support, then you are there for them. Even if you do not actually be there the moment, just when you say things like this can be very much power booster for somebody who is looking for support, mental support at least. Then you can try sharing personal recovery stories. Now, see, like I obviously, as a psychologist, I cannot disclose my client details, but sometimes when I go for awareness camps in and around the city, or um, sometimes I also go for remote villages, you can give for what I do is I give recovery stories without mentioning the name and all. But recovery stories, like I had one client who was maybe very much alcoholic. His wife left him, his children left him. But once he got treated, he did not got treated. I mean, he did not. Let's say the center, the addiction center had 3 month plan, and this person did not. He got the treatment for 3 months, got out, relapsed, came back another 3 months, got out, relapsed, came back another 1 month, and then he got back. And it's been 4 years now that he's sober. He's not taking any substance. Eventually, his wife did come back. His children again came back, and now he does come for follow up, and he tells that he's being blessed. It's like a second life. It's like uh, he has never been better. So stories like these actually helps bringing positivity to the person who thinks that everything is ending for them. Those people who are actually going through addiction at the moment and do not understand where to seek help, they feel like they are inside a deep sinkhole and maybe they'll never be able to come out. Sharing stories of recovery, even anonymously, can give them help of that power that if they can do it, so can I. And slowly the stigma will change using words like um, substance use disorder or using like somebody going through addiction and not just drunkard, addict, junkie, drug addict, but using softer words can actually bring a huge change. Then there is again In centers, like even in the place I work at, there are peer recovery specialists or peer educators. Now, who are these people? These are ex substance use disorder patients. These are, in common language, they were ex addicts. They used to take substances before, could be any substance, but now they are sober for years. They are a example, live example of what they were going through while taking the substance, what changes they had while recovery and relapse, what changes they are having now. If you know a peer, someone who is sober now after years of using a substance, let them share their knowledge. It will also help them boosting their respect and their, they'll feel included, and they'll also be able to talk to other people who maybe need help sometimes. And I've heard it a lot many times when my clients tell me that you do not take the substance, you will not understand what I am suffering from. That sometimes they say this before I start my therapy, of course. So at those times, a peer educator or a peer recovery specialist in communities can actually help a lot. If you are running a community center, if you are somebody who is planning to give help as an NGO, open an NGO, or be a part of an NGO and help people going through, addiction survivors, then do not forget to have a peer report, a recovery specialist, or a peer educator, which will definitely help them uh, improve treatment and reduce stigma. Now, I was telling you about where and when to find support. So, if you know, seek professional help if substance use is affecting health, relationships, work, or studies. The person is unable to stop despite repeated attempts. They tried a lot, many times, but they are not able to stop. Seek help. There are signs of withdrawal. I've already talked about what withdrawal is now. There's frequent relapse. There is risky behavior. Risky behavior could be self-harming behaviors, could be others harming behavior. There are times when people start being verbally abusive as well as physically abusive to family members and friends, and also themselves, physically harming themselves. So, if there is potential risky behavior, do seek help. And then there are other mental health concerns, including anxiety, depression, or suicidal thoughts. Then do seek help. Where can you seek help? The addiction and rehabilitation centers that find out that should be. There could be government rehabilitation center as well as private. Just make sure that the setting is good and that there is no second business happening inside them. Very, very important. Um, then there are regional mental institutions and government mental health service uh, that is up there. And after this webinar, do go and search for uh, what Indian government has been doing. For those of you who are from India, I can only speak about that. So there is a lot of initiative happening for addiction. So do go and check out, and you'll be knowing where and when, where to exactly find help. There are toll-free numbers available. There are um, government institutions and good institutions where treatments are given for free. If you are monetarily good enough, then definitely take appointments from psychiatrists, psychologists, and counselors for help. Last but not the least, instead of using uh, negative words, always remember to talk about positivity, um, that talk about how you are glad. You can use the sentences like, I'm glad you're trying. I'm here for you if you need support, and I'm proud of the effort you are making. And like I've already been saying this many times in this webinar, that people often remember our words, even if we have forgotten what we said then, but they'll always remember what we said. Thank you so much. I hope that you did understand a little bit about how stigma can actually break a person going through recovery, and unknowingly also how um, sometimes we might have labeled someone or used some sentences or words that were not very helpful for them. Maybe this gave you some idea how to not um, judge them or what they are going through, those people who are trying to recover. Thank you so much once again. Okay, so if uh, there is another thing, the slides are done. I just want to say that our website, Positivity, if you ever want to book a session with me, you can find me at positivity.com. It's positivity without I, that positivity.com. And I have already shared the screen. For some reason, yes. So, okay. All right.
Right. Thank you so much, Anup,
Some
for this wonderful session. And thank you, everyone, for joining us in
Thank you
as
so much.
we
I,
conclude.
for some reason, I'm not able to, it's stuck. So, Shreya, I would really like to disturb you. If you can, could you please show it? I think my slides are not really working for some reason.
Sure. Yeah. So I'll just quickly conclude, and then we'll show the website. So thank you everyone for joining in, and we hope that this webinar has given you some insights on addiction survivors. It is important as community we recognize and we try our best to help. And as Miss Annapurna said, that if the symptoms are severe or we need more help, so right, they should be going to psychiatrist or any other uh, source of help that can be needed, right? So thank you so much for that, and I will be sharing the website link as well as showing everyone. So here is our website link, and let me just present my screen. I hope my screen is visible. So this is our website, Positivity's website, and you can scroll down, read about it as well. And here are our psychologists. So you can view our psychologist, and you can see there are many psychologists. Feel free to book a session with anyone that is suitable for you. And we have total of 45 psychologists onboarded. And this is Miss Annapurna's profile. So you can see her profile, you can see her time slots as well, and her certifications and her years of experience as well. So that's her profile. I hope this has helped. All right. So I've dropped the website link on the chat. So you can feel free to visit our website and go have a look. And yes, we're looking forward to more sessions, and do join in our upcoming sessions as well. Thank you, everyone. Thank you for joining. Thank you, Ms. Annapurna. Have a good day. Bye bye.